All right, ladies and gentlemen, today is day 11. Day 11. Congratulate yourselves on achieving and completing 10 full days. 10 full days. Today is going to be another great one, okay? It's going to be another hot one here at Pulmonary Wellness Online. So have a great one, my friends. I want to start the day with a question from Kathy Lindemann, and that question is, how do we handle going to the salon, especially if we color or highlight our hair? How do we handle going to the salon, especially if we highlight or color our hair? All right, so that's a great question, okay? The salon is one very specific question and aspect and application of what you're talking about. But I am going to expand on that and talk about coming in contact with any exposures to things that will trigger you. So coming into contact with any triggers that you may have or may not have. So first and foremost, okay, it's important for you to know what your triggers are. What are the things that are going to make it more difficult for you to breathe? What are the things that are going to cause your airways to become inflamed? What are the things that are going to cause your airways to tighten up? So initially, let's think about the here and now effect, the immediate impact of your exposure to your trigger. And then afterwards, we'll go to the damage effect, the illness effect, the carcinogenic effect of the exposure. Let's start with the here and now. I go into a salon. What do you smell? You smell shampoo. You smell hairspray. You smell bleach. You smell coloring materials. You smell gels. You smell etc., etc., etc. I'm not an expert on the hair salon, although it looks like I am. Just kidding. But the idea is some of these things just smell bad, right? Some of these things will actually be inflammatory and cause you to have an immediate problem. And some of these things are actually toxic to us, are actually harmful to us. So let's talk about first the things that smell bad. And some of these things are actually toxic to us, harmful to us, potentially carcinogenic to us, causing disease. So first and foremost, is it possible for something to smell bad and not be a trigger? Absolutely. So something can have a strong odor and not necessarily trigger inflammation in your airways or anywhere else. Think of cheese, right? Most people don't consider cheese to be one of those foods or items that they come around and go into bronchospasm. So that's the smell bad, not necessarily bad for us. Then there are things like pollen, ragweed, dogs and cats, dander, grass, chemicals, dust, etc., etc., etc. And that's a list that can go on forever, okay? And those things can actually cause an immediate response. Those things actually can cause bronchospasm. Those things actually can cause inflammation in the airways and beyond. So what's going to happen now, okay? In an effort to protect you, or like in New York City, one thing that I talk about all the time, you could be standing in a corner, right? And a truck comes by you in summertime and next thing you know, you smell it, you feel it, it's all over you. If you're wearing white, you can see it, right? Now, for some people, that is enough to actually trigger an asthma attack. That is actually enough to trigger bronchospasm. That is enough to trigger a sneezing attack. That is enough to trigger a coughing fit, right? For some people, it's just going to be uncomfortable. The question is, who are you? The question is, who are you? And the answer is, it's really important for you to familiarize yourself. And I would even go as far as to say to keep a diary of the things that cause you triggers, of the things that are your triggers that cause inflammation for you, that cause bronchospasm. And again, think long-term, short-term, right? There are some things that you are going to come in contact with and you're immediately going to lock up. So for situations like that, you have to be prepared. You have to be prepared to do your breathing techniques, which can relax bronchospasm. You also have to be prepared with a rescue medication if that works for you, okay? If it's severe enough, you may have to be prepared with an EpiPen. If you're somebody who you go anaphylactic, right? So that's the immediate response. Now, there are some people who are going to become a little bit inflamed at that time, but over the next couple of days, they're going to increase a lot of mucus production, their airways are going to be tight, and that can actually lead to an infection or an exacerbation, right? Or I should say an exacerbation. So that can lead to an exacerbation, or that can lead to a several day period of you really not feeling up to par, where you're working harder to move air in and out because the airways are inflamed, where you're producing a lot more mucus. And when we talk about airways and mucus and inflammation, think of it like you have a 4-lane highway. When you have bronchospasm, bronchoconstriction, that highway cuts to 2 lanes. And when you have mucus in the area, that's like double parked cars. And then if you're lucky, you're cut to 1 lane and you can still move air a little bit. But again, sometimes depending upon the exposure and depending upon the individual, these things can happen fast. Over time, so over the next couple of days, if your airways are very inflamed, if your airways are very tight and constricted and you have a lot of bronchospasm and you're producing a lot of mucus, this is going to make you work a lot harder to breathe. And in the same way that if we started exercising vigorously without a rest, you're going to fatigue. And so in those situations, rather than wait until you're really struggling, or rather than wait until you're really in a jam, I would suggest speaking to your doctor and saying, you know what, I am somebody who has these episodes of inflammation when I am exposed to something. What can we do to prepare me for this so that if I can't get a hold of you, I have something I can do short of calling 911. And if you don't have anything that you could do short of calling 911, then by all means call 911. So back to the salon situation, my questions to you would be, is it something that bothers your nose from an olfactory perspective? Is it something that you just don't like the smell of? Because some of those hair chemicals do stink. Or is it something that's going to trigger inflammation in any part of your respiratory system, whether it be in your nose, in your sinuses, or your airways, or your lungs themselves? Is it going to cause you to tighten up? Is it going to cause you to get stuffy? Is it going to cause your sinuses to become congested? Is it going to cause you to produce more mucus? So if that's the case, then as somebody with a chronic respiratory condition, I would have to think that that is probably not worth it to me. Okay, that is probably not worth it for me. And I am going to look for some alternative to going into the salon at peak time when everybody's getting their hair done. So that might be having the person come to my home. That might mean trying to come at off-peak hours. That means letting them know in advance that you have a condition that will need ventilation. Okay, so trying to be near a window or a door that can be open, just so that there's enough to dissipate this chemical that is attacking your system. Okay, and that goes for any place else. Okay, that goes for any place else. If you know that you're going to be exposed to wildfires, or if you know that barbecues are a trigger for you and grass is a trigger, then don't go to the park for a barbecue, or do the things that you need to do to prepare for those things. So have a great conversation with your doctor in which it takes the form of, these are all the things that are triggers for me. What can I do on a long-term preventative level? Okay, and that's where medications like Singulair or Montelukast come in. Okay, and you can ask your doctor about that one. That's where things like guaifenesin come in. And then there is, well, what happens at the time? So in other words, while it's happening right now, what can I do? So that's where things like albuterol or other short-acting rescue medications come in. And then what do I do in the aftermath of that to make sure that I don't spiral downhill over the course of several days and have an exacerbation or worse, an infection? really think wearing a mask in is going to help that much. Is it going to help a little bit? Absolutely, especially if you get a mask that has a filter in it. But you know what? The environment is much bigger than any potential filter that you're going to have. And I think some is still going to get in. But again, try it. Anything you're going to do, you should try in small doses. So in other words, if you don't know how you're going to respond when you go into the salon, don't make an appointment first. Say, hey, you know what? I want to come in and spend a few minutes there. I want to come in and spend 1 minute there and see how I feel. I want to walk from front to back and see how I feel. And if you could do a minute, go out in the fresh air, come back and do 2 minutes, do 5 minutes, do 10 minutes. But don't get into a situation where you've committed to something, and not that you can't walk out of a haircut. You can, of course. But I'm saying, you know, like when you use a cleaner on your carpet or on your furniture, they say put it in an area that's not visible first. That's because if it jacks up your carpet, you don't have to look at it all day, every day, because you put it on the whole carpet. Same thing with this. So I would say expose yourself to triggers very, very gently, very, very slowly, very limited in dosage, and see how it goes. But again, I would do this after having a discussion with your physician about what can I do to prevent, and that might be in the form of a daily medication. What can I do in the midst of an attack? How do I put out the fire? And then how do I deal with the aftermath of that assault on my system? All right. Hope that was helpful to you. Kathy, thank you for your question. All right, people, day 11, let us get out there. Number 1, twice. Get it.